So this whole figs controversy, wow. What are my thoughts? As a spine surgeon, today in this video, I'm going to give you my thoughts on this whole kind of big blow up and some advice for med students, residents, future doctors out there. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So over the last few days, there has been this huge controversy and kind of fallout with a popular kind of scrub line called figs. If you haven't seen the video or the pictures online or the social media kind of outlash, I would suggest that you check this out. This has really gone viral, and a lot of people, a lot of social media influencers, a lot of ambassadors, brand ambassadors have kind of put their thoughts out online. And I've been getting a lot of questions and emails and people asking me, hey, what do you think about everything that's going on? What are your thoughts? You know, you have a pretty huge following as well. We want to hear what you have to say about this. So, but before that, I give my response. Let's just watch this video real quick. So they have a young lady who's in these pink scrubs, and she's holding a book upside down. It's called Medical Terminology for Dummies. Also, they kind of zoom in on her badge, which it says DO, which is Doctor of Osteopathic Medicine. And they go on to show more about the scrubs and about, you know, just about what they can kind of offer in terms of their scrub line. So when I first saw that, I was like, wow, that is crazy. Like, who is their social media marketing manager, or who's responsible for letting something like this be released? One of the things that really disturbed me was that I had just purchased maybe 4 or 5 sets of fig scrubs. I think they're great scrubs, and I had my name kind of embroidered on these scrubs. You know, I ordered several different colors. You know, I'm looking forward to going up, putting up pictures like, you know, check out, you know, my new scrubs. But I'm a little hesitant now on doing that because I think the eras that they made, this company, this $100 million company who has a large marketing budget, who basically uses young physicians, med students, nurses, PAs, nurse practitioners to promote their products, which in business, I love business. You know, that's one of the things why I'm in private practice, because I love, you know, business. And that's a very ingenious marketing strategy that they have displayed over the last number of years, and that's the reason why they have been so successful. So the problem that I had is the fact that you have a physician who's holding a book upside down that says Medical Terminology for Dummies, and then the person's badge says DO. So for those who don't know, a MD is an allopathic physician versus a DO is a osteopathic physician. They do a lot of more kind of hands-on adjustments, and they get trained in this type of osteopathic type manipulations that can treat a lot of patients for certain conditions. So I don't have much experience in that. I do have friends that, however, that are DOs. I know spine surgeons that are DOs. I know orthopedic surgeons that are DOs, plastic surgeons, hand surgeons, dermatologists, you name it. I know all of these physicians, but historically, you know, osteopathic physicians and osteopathic medicine has been, for some people, view it this way as a backdoor to medicine, or the students that don't get into a MD school, they apply to DO schools. And although I don't necessarily agree with that, they receive the same level of education. There's no difference whatsoever in terms of the skill set, the level of training that they get, The only difference is the initials behind their names. And that osteopathic, that DO, some patients don't really know what that is. And, there's been this stigma associated with it over the years in terms of the type of doctor that they are. But let's dispel that. There's no difference whatsoever. I've worked with lots of DOs who have been very great teachers, mentors, very great clinicians, and hopefully in the future there should be a merger between the two. Allopathic, MD, DO, there should be a merger between the two, especially for residency programs. But this marketing kind of campaign that they put out, this video, I think it was very demeaning. I think it was, it downplayed physician females, especially DOs, which was a bad idea. Now that, I'm in practice, I can see this a lot clearer now, but even as a med student, resident, fellow, I've been approached by hundreds of companies to, hey, can you post this about my company, or can we send you this free item? Can we send you a couple pairs of these shoes, and then that way you can just talk about them in your videos? I do some sponsorships, but I limit the sponsorships to something that I actually believe in, products or things that I would actually use myself. I would never use my medical degree, my platform, to push things onto my viewers for the wrong reasons. And I'm very critical, I'm very particular about that. If I got 100 offers, I would probably accept maybe 1 or 2 of those offers. So it has to be something that I would truly believe in and use myself. So what I see lately is that a lot of social media influencers, they talk about different products and the discount codes and working with these companies, which the companies are using their medical kind of profile, like a potential medical doctor. They have this statue and the way that they're perceived by the public, and other people see this, and then you're promoting these products, or even if it's just scrubs, that I have a problem with that. So especially companies that make a lot of money off of influencers online. You have to be very careful. The med students out there, pre-med students, residents, your name, your image, your brand is very important. And you work really hard for this. I would hate for you to go through all of these years of training and your brand is destroyed by developing relationships with certain companies or certain products or certain brands that don't align with who you are and kind of what you do. So be careful. You're going to be reached out by hundreds of companies, hundreds of different products. People are going to try to sell you things. And lately in private practice, I have probably been approached by 30 financial advisors since I've started my practice. There's nothing wrong with that. They're just doing their job, but it does get really annoying at times when they're constantly, hey, can I meet? Let's meet a phone call. Let's do this. I understand they're trying to do their job, but especially as a physician, you don't know what people's true intentions are, and you have to be very careful about who you associate with and what you decide to display and then online with your brand. So I think this was an error on their part. You have to do better with this. Osteopathic physicians, there's no difference between an MD and a DO. Women physicians, we need more of them. And the reason why I do a lot of things I do online is to try to increase minorities as well as women in medicine. So if you notice my channel, I focus on women and I focus on minorities because I think representation is important. You can't become something that you can't see, and that's kind of my passion. So on the flip side, a lot of companies make mistakes. I have made mistakes. I have done things in the past that, I should not have done. And I think people should, you have to have a way to at least apologize and tell us what you're going to do to move forward. And that's something that I'm waiting to see. They put out some statements, and I'll put that kind of up in terms of their plans, but actions speak louder than words. And if this company wants to have my business or any other of my followers or people that I associate with, a lot of physicians, they're going to have to do better than that. As a medical student, resident, fellow, pre-med student, PA student, nurse practitioner, just be careful. Know your worth. Companies will try to, utilize what you have attained and worked so hard for. You don't want to ruin your reputation. And don't feel like you have to be a brand ambassador or be a social media influencer for every company that reaches out to you. Just say no. Your primary goal is to learn and be the best doctor that you can be. Go through and get your education and your training, and then take care of patients. That's your number one mission. That's your number one goal. That's what I try to do. But this is a big error on their behalf, and I won't be purchasing any more fig scrubs. So if you know any company that's minority ran or any company that has the best interests of people like me in mind in terms of giving back to the community, focusing on areas of the world that we would like to improve on, and just is an overall good company. Most of them are good. There's some that try to exploit, the young doctors, medical students, residents, things like that. So just be careful. And put it in the comments below. Any companies, good scrub lines that you guys recommend that I try. Unfortunately, I made a mistake. They lost my business, and that's my thoughts. What are your guys' thoughts? Put it in the comments below. But thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.